Researchers say they have found another life-saving therapy to prevent deaths from COVID-19, exactly a year after the discovery that a cheap steroid drug did something similar. Treatment involves using antibodies to neutralise the virus. That means it's only effective in people whose bodies have not previously developed antibodies to the disease. A single course costs up to $3,000. Clinical trials suggest it could help 1 in 3 people in hospital with severe COVID symptoms. And for every 100 patients treated, experts calculate it would save 6 lives. Let's speak now to Professor Sir Martin Landray, an epidemiologist from the Big Data Institute of Oxford University. He is at the Joint Chief Investigator for the recovery trial for COVID-19. Sorry, that was quite a mouthful. This sounds quite a significant development. How did it come about? Was it through random science or targeted science?
The science itself is targeted. Of course, a year ago, this was a new virus and we had no new treatments. But during the course of last year, many companies were developing antibodies targeted at the virus itself. And then from last September through to the middle of May, we ran, and actually to use a word you've just used, a randomised trial in which patients in the NHS either got the treatment, the active treatment, the monoclonal antibody, or they got the best usual care that the NHS could offer, but without the additional antibody. Now, that's been enormously successful study because 10,000 people were enrolled. These are patients who are really quite sick, they're in hospital. And as you've just highlighted, what we found was that for patients who had failed for whatever reason to develop antibodies of their own, if you give them some in the form of this drug, then actually we save lives, shorten the time in hospital, reduce the need for ventilators. Good for the patient, but good for the health system, both here in the UK and elsewhere.
The previous discovery, I think, was dexamethasone. Does this need to be used in conjunction with that?
Yes. Most patients who are in hospital have low levels of oxygen, so they require oxygen or possibly even ventilators. And this treatment works on top of that. So by comparison with where we were at the beginning of the epidemic, dexamethasone saves some lives. Adding this on for the people who haven't got antibodies saves more lives. Actually, there was another drug in between, a drug called tocilizumab, which is another immune suppressant drug, which also saves lives. So we've now got 3 treatments for the sickest patients will improve their chance of survival. That's a big step forward and wouldn't have happened without this enormous clinical trial here in the UK, run by frontline doctors and nurses in the most difficult times over the last 6 months.
Of course,
or so.
And just briefly, was this the treatment that doctors used on President Trump, which was semi-experimental at the time?
Yeah, it's exactly that treatment. And you're right, it was experimental at the time. It's still not licensed, but I wouldn't say it's an experiment anymore. We now know it works.
All right, OK. Professor Sir Martin Landray, thank you very much indeed for joining us here on BBC News.